Hi Ramesh, welcome. So, as you wanted to share some thoughts about how we can break this COVID chain, I thought let's get on this conversation. Why don't you tell our viewers on what do you want to share about your thoughts on how we can break this COVID chain? Before we get started, can you introduce yourself, please?
Yeah, sure. So my name is Ramesh Gupta, and I'm an IT by profession. And we are based out of Bangalore. Been in Bangalore for almost 25 years now. So looking at all the COVID chaos and the COVID number of COVID cases rising every day in the states all over the country, and the kind of impact it is having, right? And also being impacted personally by the COVID, some of the losing family members, right? And so, and also we had one loss in the neighbor apartment where we were staying. They started thinking about, okay, now what is it the major factor that could be probably contributing to the rise in the COVID infections, especially the most virulent, the current second mutant or double mutant variant, right? Where without any symptoms, suddenly the patients will start experiencing severe, they'll go into, oxygen saturation coming down severely. So the primary, one of the reason probably is, right, what we normally see is that people, however it is, even in spite of all this Swiggy, door delivery and all those facilities being around, most of them will still have to physically go out and buy groceries, vegetables, your day-to-day essential needs.
True.
Right?
Yeah.
And when, yes, and some of them will go to supermarkets, some of them will go to a small time kirana shops, and some of them thinking that, okay, yeah, this is the time probably to support the vegetable cart vendors who are really in need of the business or some income. So people also will go to these small time. People who can sit at home and afford, they will definitely go with the big basket and Swiggy and all. Even big basket is all swamped now, and you don't get deliveries now. There are a lot of places where big basket itself, their hands are tied because of the influx of the number of. So the main reason probably, right, could be the asymptomatic, transmission that is happening. Otherwise, virus, one is direct person to person, through the surfaces or asymptomatic transmissions. Now, similar to what, how we considered the health workers as a frontline workers, and now journalists also being tagged as frontline workers and vaccination to be taken on priority. What I think is that all the shopkeepers, kirana shops, vegetable vendors, pushcart vendors, your hotel workers or day-to-day wage earners, right? All these people who make a living out of the day age earnings, right? Or the lower, income jobs, where it is very crucial for them, right? So we should consider them as a frontline workers and take up vaccination on priority. For example, construction workers. Now, on one hand, we are saying that, okay, yeah, these are construction activities allowed, but imagine the guy, people who do not know or who are not even aware that they're asymptomatic, because they're the most exposed. And people on the ground, people who are working, physical security guards, apartment security guards, for example, they don't even realize, right? And affordability also, RT-PCR test 2,000, 3,000, and all the scan is 4,500 rupees, and they will not probably think of going there and then getting a scan done and being in home quarantine. Home quarantine is a luxury for them. So we should probably consider all these as a frontline workers and vaccinate them on priority. Thereby, those touch points, right, where they come in contact with 50 people, 100 people, 20 people, right? Those, that transmission change can be broken. Agricultural laborers, for example, they all should be vaccinated. Shopkeepers, you should get vaccinated. And then probably should even think of, extreme step of, okay, guys, any shop, if you want to keep it open, you should be vaccinated. And you need to devise a mechanism of, how do we track whether these people are really getting vaccinated or not? Because you can look at, putting a home quarantine seal on the hand, or you can think of some better ways of monitoring these and ensuring, or door-to-door vaccination. This is the time. And once you cover these, the most vulnerable or the most, possible ways of, virus getting transmitted, I think, you can break the chain to an extent. And probably we should try this model in a couple of districts or small towns and then see whether this model is working on. Today, you saw the photo in the news, because of the lockdown being announced, there is a sudden influx of all people flooding to the, or queuing up in the supermarkets and some of the outside Bangalore's where the open markets, for example, there's a fertile ground for all the virus, exploding, right? And you should look at all the supermarket or wholesalers, fruit vendors, right? Vegetable wholesale market dealers, traders, all of them should be vaccinated. So if you do that, then they will not get infected. If at all, they will be very minor and probably very few people. And it is proven that vaccinated people, only 2% of the vaccinated people can get into a situation of having to go to the hospital, or even less than 2% probably going to ICU. So I think this should be the model probably government should adopt, or all the NGOs or whoever is doing a service today, and probably should take upon hand in the local bodies, or be it your BBMPs, or all of them should, if you adopt this, I think we can definitely break this. And now that last year vaccine was not available, now we have a lot of options available, and we should make it a priority to vaccinate all these important frontline workers, like all these categories that we spoke, and thereby you will minimize, at least to an extent, great extent, minimize the the risk of transmission continuing. So those are my thoughts. And by doing this, also what you're doing is, you are not impacting the livelihoods of all these people who are completely dependent on the monthly wages and non white collar jobs, right? And thereby you're also helping them greatly by vaccinating on priority.
Okay, thank you, Ramesh, for sharing your thoughts. Let's share this video in our known circle and see what people have to say. And if people like the idea, we request you to please like, comment, or share this video in your circle so that it can reach the right people and the right action steps can be taken. Thank you, Ramesh. Thanks for your time.
Thank you.
Bye.
Thanks. Bye.